Hello everyone, my name is Lauren Boylan, and my presentation is a Hello everyone, my name is Lauren Boylan, and my presentation is on lateral violence in nursing. At the end of the presentation, the learner will be able to do the following: verbally identify 3 behaviors of nurses that define lateral violence, discuss one effect that lateral violence in nursing has on our healthcare system, and discuss one effect that lateral violence in nursing has on our society. So what is lateral violence? The concept of lateral violence, or horizontal violence, was first discussed over 3 decades ago. Lateral violence can be defined as a pattern of workplace conflict in which hostile, aggressive, and harmful behavior by one nurse towards another nurse or group of nurses by way of attitudes, actions, words, or behaviors. Initially, the behavior was believed to be related to a lack of power of nurses within the workplace. However, there is not one specific cause of the behavior to current time. Recently, the most highly endorsed potential cause of lateral violence among nurses is the stress related to inadequate staffing or resources to handle the workload. Lateral violence and the nursing profession. So lateral violence nursing behavior is intended to overtly, purposely demean, humiliate, or diminish their peers' character, which results in social exclusion in the workplace. Examples of the behavior includes, but is not limited to, verbal assaults, persistent criticism, belittling, eye-rolling, withholding information, refusing to help, and gossiping. Lateral violence leads to high turnover rates within the profession, which increases the financial burden of the institutions who employ nurses, who also spend approximately 25 to 50% of annual nurse salaries to replace nurses who leave. It is believed new nurses are more susceptible to the violent behaviors, and an estimated 25 to 33% of newly licensed nurses will leave the profession within 1 year. Student nurses often either experience or witness lateral violence during their clinical rotations. By leaving these situations unaddressed, it can lead to the formation of continued lateral violence routine and become an expected aspect of nursing to student nurses. Workplace violence directly impacts staff satisfaction, employee turnover, staff members' mental and physical health, patient satisfaction, and quality of care. The Joint Commission identified that intimidating and disruptive behaviors fuel medical errors and lead to preventable adverse outcomes. Due to the negative impacts on patient care, the Joint Commission for Healthcare Accreditation appealed to all healthcare organizations to take measures to decrease behaviors that undermine a culture of safety. Therefore, lateral violence has a major influence on nursing practice as well as the healthcare society. Lateral violence in healthcare is extremely costly. It is also destructive and places patients at risk of diminished health care. Workforce retention is another casualty of bullying and lateral violence. And lateral violence also creates negative patterns of communication across the spectrum of healthcare team members, which ultimately leads to increases in medical error, which in return costs the healthcare institutions millions of dollars. Lateral violence in nursing also impacts our society in many ways. The biggest way that influences society is that it gives the public eye the impression that nurses eat their young, which contradicts the values that the general public expects from professional nurses. In a sense, nursing lateral violence also contradicts our vows that we take and abide to by the Professional Code of Nursing Conduct when we all graduate and sit for our boards. Overall, it leads to a lack of active nurses within the workforce within our society because as new nurses come on or witness these behaviors and experience them themselves, they end up leading. and that creates more holes, and it's just a continual cycle. Oftentimes those who do stay and were subjected to experience lateral violence while they were newer to the field or transitioning to a new unit, and they decide to stay in the field, oftentimes as a senior nurse, they exhibit these behaviors to newer nurses as well. It also created a need for educational reform within nursing to educate nursing students about the concern for workplace violence. So recently, over the last 2 to 3 years, it is becoming almost a mandated policy in the curriculum to educate new student nurses on the effects of lateral violence and ways to end it. Overall, some key points are to remember that lateral violence in nursing is being a bully. Lateral violence is costly to our healthcare system as a whole, and lateral violence makes the profession of nursing look unappealing and unprofessional in the eye of our society. So what can we all do together? We can all do our profession a favor and break the cycle. Thanks for viewing my presentation, and my references are listed below.